Well, the law has just been voted on in the national parliament and passed. And it will give the government greater legal powers to close organisations such as shops and shopping centres and gyms and bars and places like that if circumstances require it. It's not terribly draconian compared with those powers used in other countries, but it does give the government a few more options if it goes down that road.
Of course, in recent times, we heard the Swedish king saying that Sweden had failed to save lives with that approach to the pandemic. So has there been a change in attitudes?
Yes, to a certain extent. I should make clear that it hasn't been the case that Sweden has just carried on as normal. There have been restrictions imposed by the authorities and a battery of strong recommendations about how people should behave, particularly with emphasis on social distancing. But certainly it's true that these measures have been less restrictive in other European countries. I think for the most part, they've had fairly broad public support for much of the time. But things changed after the autumn here, really, when the authorities' reassurance that there would be no great second wave in Sweden, that the worst was already over after the spring, that showed to be completely misjudged. And I think support for the authorities' line has diminished since then. The government is not quite enjoying the popularity that it was previously, and trust in the specific institution that runs policy, the Public Health Agency, has also diminished. So things have changed somewhat, yes.
So on that note, was there a divide between the health officials and the government?
Well, there has been, you have to say so. One of the most extraordinary things about Sweden's policy, apart from the content of the policy, which was less restrictive, as we've discussed, was the fact that the elected government simply stood back almost completely and left everything to the Public Health Authority, to the unelected bureaucrats to decide how to run things. And they were given a completely free hand and pursued a policy that was out of step with the rest of Europe. The government began to get cold feet about this arrangement a few weeks ago as the death toll began to rise again, and this second wave, which the agency had promised wouldn't arrive, did arrive with a vengeance. And so some extra measures were implemented by the government without first going through the Public Health Agency. And that tension has abated somewhat over Christmas as everything has sort of quietened down. But I think that tension is certainly still there, and it's a potential problem because signals are being sent from two quarters that are not always entirely in accordance with each other. And that has been a problem and is potentially quite a big problem.
And is the man in charge, Anders Tegnell, how much blame is being pointed to him?
In the start of the pandemic, around about the spring, he was widely respected and even very popular amongst big swathes of the electorate. He sort of represented what a lot of Swedes like to feel about their country and themselves, which is that they're just a little bit more advanced and sophisticated and above all scientific than everybody else. And his prognosis about how the pandemic would develop, and particularly about how the more restrictive measures seen elsewhere weren't necessary and were in some ways counterproductive, they were widely believed. That has become much less the case, and he's now much more critically received in the media. He was given a very easy ride in the spring, but that is less the case now, I'd say.
And as you mentioned earlier, the emergency laws have now passed the parliament. But what about the vaccine situation? Are Swedes open to getting the injections?
Yes, compared to Britain, Sweden, like the rest of the EU, has got off to a pretty slow start. But it's rolling in now, and the program is underway, and it's happening anyway. It remains to be seen how well it's implemented from here.
Okay, Nicholas Aylott, thank you very much for giving us your analysis.